So I will actually let everybody introduce themselves, but as a whole, we're an interdisciplinary group of 2 palliative care physicians and 2 palliative care social workers who are engaged in education via the Hospice and Palliative Medicine Fellowship Leadership, and then 2 of us are 1 year out from training. And so we wanted to put our heads together and really make this an interactive conversation about mentorship within pediatric palliative care and how that overlaps with education. So as we introduce ourselves, feel free to introduce yourself too via the chat. You can put your name, institution, and we're hoping to build more community through this lovely community as well. So I'll just jump in. I'm Brittany Kaufer. I'm a pediatric palliative care doctor and oncologist at St. Jude, and I'm also an associate program director for the Hospice and Palliative Medicine Fellowship here, and have some other roles in wellness and education, and excited to chat today. I'll pass it over to Stephanie next.
Well, hi everyone. My name is Stephanie and Sarah. I am a social worker, an outpatient social worker with the palliative care team, and I'm also the palliative care team's bereavement coordinator. So I do a little bit of both throughout the year, and mostly at the end of the year, I do the candle lighting ceremony, and my role looks very different every day. Thank you, Brittany, for having us here.
Perfect. Claire?
Hi, everybody. I'm Claire Crawford. I'm a member of the card-carrying fellowship fan club at Texas Children's Hospital and have gotten to be part of it for a little while now. I'm a social worker on the team, and I also lead the social work fellowship here, which has been around for 2 years now. Got to see that start with Stephanie and then another social work fellow. And I have been mentored a lot and find myself mentoring a little bit now, which feels a little uncomfortable to be in that position, but we'll talk about that later, and glad to be here today.
Wonderful. Jared?
Cool. And I'm Jared Rubenstein. I'm one of the doctors on the Texas Children's Palliative Care team, and I'm the fellowship director for the physician fellowship here.
Fabulous. All right, let me, try to make technology work so I can provide a little audio visual. And thank you to all of you who are jumping in to introduce yourselves in the chat as well. Okay. All right, so this is us. So I will jump to the next slide. So what is mentorship? I feel like it's one of those things like the when you know it, you see it kind of thing. But I think it can be helpful to have a definition. And so I'll briefly read this. Mentorship is a professional working alliance in which individuals work together over time to support the personal and professional growth, development, and success of the relational partners through the provision of career and psychosocial support. So this felt like a very modern and inclusive definition to me. I think there's this traditional idea of like the mentor like bestows things upon the mentee, and that it's this unidirectional like sharing of information. But the reality is, as we'll talk more about, that it's really bidirectional. So acknowledging the relational partners aspect, and that it's not necessarily limited to the academic space. So this was actually a definition from the National Academies of Science, Engineering, and Medicine Committee on Effective Mentoring in STEM, which I think is pretty awesome. So we will jump in. I'll let Claire take over.
Yeah, so as I mentioned in my own introduction, I have been mentored a lot, but I've also started mentoring other people, and I think that most of us here would probably be able to say the same, whether you're early in your career or later, that you've had some experiences where you were mentored perhaps earlier in your career and where you become the mentor, which can have some imposter syndrome associated with it, which we'll discuss a little later in the presentation. But what we wanted to do starting out is really think about what it means, not so much by definition to be a good mentor or mentee, but instead what it means by your own criteria. How do you define being a mentor or mentee? So we want to do a couple of exercises where we just reflect on this. First, I am so excited that you're all participating in the chat. That shows me this is going to be an interactive group, which is what we wanted. So please take 90 seconds, and I am going to time it, to ponder the characteristics of the best mentor or mentee you've ever had. Write those in the chat, but don't click enter to show all of us what those characteristics are until I tell you to in about a minute and a half. So go ahead, write it down, and then I'll let you know when to post it. Okay, go ahead and post what you've got, and we'll read through it. Okay, I'm seeing good communicator, honest and brave, encouraging, knowledgeable, intentional, available, and enthusiastic, approachable, humble with expertise, which is a really good combination, curious, generous assumptions, realistic, and mine have been people who gently push me to try things that I am nervous about. I'm one of those people. I happen to know another social worker on this call who's like that too, who sometimes needs a physical push to get going. Let's see, someone who is engaged, me and themselves in reflective practice, direct but kind. Yes, I definitely am like that. I like directness and kindness. I like your response, Amber. I see a lot of humility in the comments, encouragement, understanding. These are some wonderful words. And the other question we wanted to ask as people continue to enter those answers into the chat is, what is stopping you from being the mentor or mentee you hope to be? This one will be a little bit shorter. So go ahead and write in the chat, and then after a few seconds, I'll let you know when to enter your results. Okay, go ahead and let us know what's keeping you from being the mentor or mentee you'd like to be. Imposter syndrome, yes. Time is so limited when you have so many other things to do. Demanding environments, confidence. Time fatigue, remembering what it was like to be at that stage, lack of knowledge. And that's kind of why we're here today, is we're not experts in how to be the best mentors or mentees, but we all have had our own clunky experiences trying to do the best we can. So we want to share with you a little bit of what we've learned, how we hope to be the best mentors and mentees we can, and hopefully enrich our own practices through that kind of mentorship. I have certainly found that being a mentor has been one of the most rewarding parts of my career, and I wasn't even necessarily meaning to. So I'll let Jared get into the types of mentorship that are out there, some of which you might not have known about.
All right. So when we think about the different types of mentorship, so when we were putting these slides together, we all kind of laughed about the different hats and had different interpretations of what each hat meant. And so I'll give you all mine, and then we can maybe share and compare notes. And so when you think about the different types of mentorship, they can be broad and they can be different needs and different reasons for doing any of them. And so when I think of coach, advisor, and sponsor, the three on top, I think a way that I heard that kind of was stuck in my head that resonated with me was that a coach talks to you, an advisor talks with you, and a sponsor talks about you. And so for me, when I think about a coach, it's someone that is giving you tips about a certain thing, like thinking about the sports metaphors of a coach, and that it's you're coming to someone with a specific ask or a specific need, and they're giving you tips and strategies for around that based on their experience. For the advisor, there's the chef's hat there because it's sort of like thinking about somebody that you're teaching recipes and you're coming to them for maybe with a specific question, maybe just a more general big picture need of career development. And they're not exactly telling you what to do. It's more just sort of helping you put together your menu and helping you put together the different ingredients that you'll need to set you up for success and being there to troubleshoot and work through the recipes with you. And then a sponsor is someone that's going to talk about you when you're not there. That's the top hat is sort of like they're presenting you on stage, that when you're not in the room, when an opportunity comes up, they'll say, oh, have you thought of this person? Or they'll talk with you and tell you that they're setting you up for an opportunity and that they're going to recommend you for something that you maybe wouldn't have thought of for yourself. And the sponsor is the person that either kind of pushes you forward or reaches out to somebody else to pull you up to the level that they're at. And for those top three, I think those are, I think what people think of as sort of the big three types of mentorship and the three that we've all had experience with. The two at the bottom are ones that I think have increasing roles and are kind of becoming increasingly important. And so the peer mentorship we think of as kind of the you, quote unquote, at another institution. So folks that are maybe similar level and skill, but doing something. And for this, I think of as sort of what I think some of us have found a kind of the academic loneliness of being in an institution that if there's only one you doing your thing, that by definition, there isn't anyone locally to you or at your institution that may be doing the same thing. And so having someone at another institution that you can reach out to just talk about, they don't necessarily have more experience, but they maybe have different experience doing the same thing. And just because two heads can be better than one, kind of someone to collaborate with. And so for me, I'll share an example of my peer mentor, Amy Trowbridge, who I reached out to at some point to say, hey, can we have a Zoom meeting with the normalization of Zoom that happened? And then it's something that since then we've been able to meet periodically and just we're doing kind of similar things. We're doing some different things and we pick each other's brains and talk about, what thoughts we have, what experience we have. We can bounce ideas, we can brainstorm things together. And we'll talk a little bit more in one of the later slides about some of the great stuff that can come from these types of peer mentorships. I think another example for peer mentorships in our field have been what some of us have started in the medical education, the fellowship leadership group, knowing that a lot of us were coming to that role with not a lot of experience in either finding ourselves the head of a fellowship or starting a fellowship and feeling like we didn't know what we were doing. And we sort of jokingly called ourselves the Clueless Program Directors Association. And what started as three of us became a lot more of us, realizing that we can help each other figure out where we're going together, even if we don't have a ton of experience together. See that I'm getting some shade in the comments. We'll get to that later. Thanks to both of you. I think another example is the great work folks have done in our field for people that were taking on division leadership roles early in their career and realizing that there's not a lot of training that's out there for those roles, but folks kind of built a sort of infrastructure to have recurrent meetings to talk about how to be a division leader for people that didn't have a lot of experience with it. And it wasn't even that it was people with lots of experience talking about people with less. It was sort of just people figuring it out together at varying more recent levels. And I think there's a huge power to that and being able to think about things together and figure out a way forward and grow our field together. And then friendship, I've heard different definitions of this too. The one that we use is having a peer mentorship with someone that's not in your field, but there's overlapping interest or expertise. And so for me, one of my first friendtor and the person that to me coined the term friendship is a friend of mine named Liz Salmi, who is a woman that has communication and messaging training, but is not in healthcare. Then became a woman with a brain tumor and started thinking and talking about healthcare a lot, and now works for different healthcare organizations and does a ton of work in the healthcare messaging and communication space, including working for Open Notes at Harvard. But we both had a similar interest in palliative care, and me as a professional in palliative care and her as someone that had some lived experience with palliative care, were able to talk and bounce ideas off of each other. And for some of her professional work, having the experience, having the insight from a palliative care doctor, and in my work on thinking about palliative care messaging, being able to talk with her and say, you know, you're someone out in the community. How would this sound to you? How would this feel if somebody was putting out these messages or thoughts to you? And it's something that we've been able to help each other grow our careers as we move forward, that we have somewhat overlapping, but also hugely differing experiences. And it makes both our professional roles richer, as well as just the camaraderie that comes from sort of similar overlapping interests. Any questions about any of this stuff? Or thoughts from the team?
I just want to share that my peer mentor is Rachel Rush from CHLA, and she's a social worker out there. But if you asked her if she was my mentor, she would be like, no, Claire's my mentor. And we go back and forth on this and finally realize that we're mentoring each other. But it's really nice when you find somebody who's actually done the similar work that you do, because when I started here at Texas Children's, I didn't have another social worker to look to for this role. I had to figure it out with the help of other people on my team who are not social workers. So it can be really refreshing and helpful to find that someone else out there is doing the same thing, and to have the bravery to go actually talk to them, which is something I've learned from Jared, that you can actually just reach out to people and be like, hey, you seem cool and you do the same things I do. Let's talk.
Yeah, I can also share that being a bereavement coordinator here and having to learn a lot of the things that a lot of the programs that our team has was a journey. And so I had to also reach out to other bereavement coordinators at other hospitals. So kind of that peer mentorship we're talking about. And then we had a perinatal bereavement coordinator join our team, Amber, which is she's here in this meeting today. And so kind of her and I have been mentoring each other in a way, because she has a lot more bereavement experience than I do, but I'm helping her with the kind of the program development and things like that. And so it just kind of comes up to you, which we'll talk about later, how it's a little sneaky and yeah, just kind of building those relationships with other people that are doing what you're doing, but you know, you don't really have that support here for someone that's doing something similar to you.
Anybody else have anything else they'd like to add? Agree with our hats? Don't agree with our hats? Just checking the chat. Okay. Perfect. We will move on. So, Dr. Kamali Thompson is a U.S. Olympic fencer and an orthopedic surgery resident at Temple University. And Dr. Erica Taylor is the first Black female orthopedic surgeon at Duke University, per my research at least, and the chief medical officer of DEI at Duke. Together, they published this article with the citation there on the right that is about the importance of inclusive mentorship. And they noted disparities, particularly within their specialty of orthopedics. So this first figure really shows the phases of mentorship and going, I would say, in kind of really how invested you are sort of as a mentor, recognizing that inclusive mentoring is really kind of the next level, even beyond sponsorship. And this is something that we should really be striving for, of mentoring across differences and ensuring sort of equitable access to the benefits of mentorship, thinking about recognizing stereotype, threat, biases, and microaggressions from the basis of effective mentorship. And they note really, so people tend to intuitively search for mentors who kind of look like them in whatever capacity that may be of how you show up in the world, physically, or sort of your ambition of the things that you're seeking out. And that often creates this sort of unfair burden of mentorship, or just having a lot that they're carrying for underrepresented minorities in healthcare. And they also note that inclusive mentorship can truly elevate underrepresented populations in medicine and create intercultural relationships that can also benefit the relationships we have with our diversifying patient populations, which I thought was a really lovely quote. They identified numerous barriers to inclusive mentorship, which I thought were really interesting and valuable to think about as we all strive to be more inclusive in mentoring and sponsoring. And one of those is this idea of traditional views of success. So someone who doesn't fit sort of the traditional mold of the specialty of medicine may deter a potential mentor who doesn't feel like, from their view, that that person has a good chance of success. So we should really be asking mentees to define what success means to them, to help people really strive for their goals, rather than kind of as mentors if we have our own goals in the back of our minds. Lack of validation of experiences was another. So that's this idea of making excuses and invalidating the negative experiences that mentees have, like that happens to everyone, it's not you, it's them. Focus on rescue is the assumption that all mentees want to break the glass ceiling or push past barriers, and not that they're happy in their role and are trying to optimize their success there. Diminished value of achievements, I think, is a really interesting concept. This idea of the rising star mentality of continuing to sort of often unintentionally make this idea that someone is having to prove themselves, or they've never really arrived, because they're always being discussed as kind of the next big thing or the rising person. And I think that happens a lot. I feel like that's something that I still see a lot, but that can be really demeaning and reinforce this subordination sort of mentality. And then mixed goal agreement and mixed motivations is really more about the mentor being interested in the role of being an inclusive mentor because of their promotional benefit or prestige, and not necessarily interest in the individual, which can be also very damaging. So in this article, they also discuss approaches for inclusive mentorship, such as embracing differences, practicing humility, particularly on the role of the mentor, but in general, recognizing the differences, empowering rather than focusing on rescue, learning about cognitive biases that we all have as humans, and then this concept of co-creating the future together, rather than it being all about kind of the mentor's vision of what things should be or look like. Feel free to jump in at any point with comments. I'm trying to watch the chat here, but if not, we can go ahead.
Okay, so what is the value of having an interdisciplinary mentorship? One of the, in my opinion, the biggest one is that it'll be bi-directional. So for me personally, with my role, I started off as a fellow, a social work fellow, the first one of the program. And so I was able to, during my fellowship, experience that bi-directional mentorship between me and the two medical fellows, between me and Brittany and Matt. I remember when I read the job posting and it was talking about how you'll be able to work with doctors, chaplains, nurses, nurse practitioners. I was really excited for that part because typically social workers work very independently, especially in hospitals, and they never really get to have that interdisciplinary experience with others, even though, you know, you have the same patients with doctors and nurses, but aside from like that referral that's placed, you don't ever really get time to discuss or go into detail. So I was really excited for that and being there in the same room with Brittany and Matt and learning the medical piece. I had so many questions all of the time that Jared and everyone answered, always were so patient with me, especially since it was my first time ever in a hospital. So I would say that that bi-directional um, part of the mentorship was very helpful for me in growing as a social worker and as now a bereavement coordinator. And another part of this would be having new perspectives. So again, I was able to see things from the medical perspective. And also, as not really having experience, I was able to see the perspective of families, kind of how they would think through things. So I would always have that with people and also being a Latina, kind of talking about that experience and bringing that onto the team. Um, so it was a lot of new perspectives and very bi-directional, I would say, throughout my first year and even now. Um,
And I
Go ahead.
know that there's a lot of, we sometimes talk about the sad hands in palliative care. So there's a lot of hands in this picture, but one of the things that the reason that that is there is that our group of fellows recognizes an educator every year within fellowship, and the we recognized one of our palliative care social workers, particularly because she did a lot of teaching with us about use of therapeutic touch because she's an expert at that. And that's something within medical training, I feel like that we don't get really is thinking all that much about how to use touch and particularly in emotional interactions with families. And so she spent a lot of time teaching us that and sitting down and talking through that. And I think that was another beautiful piece of the value of sort of interdisciplinary mentorship around that as I continue to grow in comfort, especially in the post-COVID era or COVID era, really still at the time of like, you know, what does touch look like now after we've had to be so separate and not touching and kind of thinking through that as well. Um, and then, sorry, Stephanie, I kind of interrupted you. Did you
No,
have other
that's
things that you wanted
perfect.
to add?
No, please jump in if you guys have anything else to share.
I was going to mention another thing about the bidirectionality. One thing that was really cool in your year, Stephanie, of fellowship is that, you know, yes, we're all trying to mentor you as the fellow, but you were also teaching us about teaching because we would ask you, you know, what has worked for you and what would you think should be different for next year's fellow and where should we make changes in the schedule? And you would be able to tell us what we should change. And so there was a lot of shaping of the fellowship program through your eyes and us learning about your perspective as a newer social worker and as a Latina. And you gave some wonderful presentations to our whole group. So I think there was so much value, even if you might not have seen yourself as a mentor at the time, you were sharing a lot with us too. And the other thing I was going to say is going back to this idea of interdisciplinary mentorship. Like I said, when I first started at this program, the previous social worker had already left and she had gone on to do other things. And all I had was the doctors and chaplains and grief and bereavement specialists that I rotated with. So I kept asking my boss at the time, who was a nurse, what is my role? What am I supposed to be doing? And she just told me to observe and listen for a while. And I learned more in that first year than I ever could have imagined. And it wasn't all social work per se, but I was seeing the expertise of so many different kinds of people on my team through a social work lens. And then I was able to shape the social work role on the team from these many perspectives that I was gathering together. And I still do that. Everyone on the team has training from different backgrounds and institutions. So it's a constant learning process.
Thank you for sharing that, Claire. Yeah, so there is a huge value in being together as an interdisciplinary team. We learn from one another. We take small parts of each other. I remember at the beginning of my fellowship, Jared would describe it as like, I'm not gonna say it exactly, but it's like you're like this, like you're gonna be taking pieces of like Shannon and Claire, which are the social workers on our team, and others, and then you're gonna become like morph into this. You can probably say it better than me, but you'll
It's the
morph into this.
Frankenstein's monster where you're a shambling mass of parts of all the different people on the team. And you like clotting around the hall as a mass of parts. But then at the end of the year, you reintegrate all those parts into yourself again.
Yeah, that's what it was. I know I struggled a lot at the beginning to find who I was gonna be as a social worker, and I wanted to do the touch that Shannon does and the soft talking that Claire does, and the like the all of that stuff. I wanted to do it, and so I did morph throughout the year, and I still am morphing. So yeah, there's a lot of benefit to that, and even when we don't do visits together, there's parts of others that come out through us, to provide this holistic care to our patients and families, and even the spiritual aspect with our chaplain, being able to validate families through their spiritual distress, or through their emotional distress, or maybe even asking a little about pain, and kind of going through that. So I can say for me, it's shaped me um, greatly as a professional.
Cool. So sneaky mentorship, the best kind of mentorship. I think all of us have had the experiences of being assigned a mentor at various pieces in training, and there's a value to that, and I think that can be beneficial. But I think a lot of times it can feel forced, and it doesn't feel like there's not that organic nature of, I think, some of the richest kind of mentorships. And so we want to talk about the different ways to kind of put yourself out there, either as a mentor or a mentee. And I think there's value to both and kind of taking the lead to initiate the relationship. And so social media, I think for those of us that can sort of get over what maybe our initial disgust with it, has a lot of benefits. And being able to connect with folks at different institutions, being able to meet people with either in or a little bit outside of your field, and make those relationships. And again, I think with the normalization of Zoom and having meetings like that across institutions, I think it's been hugely beneficial for the ability to have mentorship at an institution. And again, like we talked about a little bit before, I think as much as I think there's always the worry that you're going to bother someone or waste their time, but I think what we found is that, a lot of us appreciate the connection, and a lot of us feel kind of academically lonely, and a lot of us feel like it's great to have that connection either as a mentee or a mentor, or a little bit of both in the case of peer mentorship, and just reaching out to someone that and saying, hey, would you be up for a coffee, or would you be up for a Zoom chat? And in either, whether it's someone that's a peer, whether it's someone that's more senior that you're looking for mentorship, or whether you want to reach out and see someone that may be a good mentee, being able to just reach out and take a chance and try to connect with someone and get over the initial the discomfort of that, I think can be huge. I think similarly, whether you're a mentor and you're helping your mentee, or whether you're doing it on your own, kind of applying for a stretch opportunity and putting yourself out there and realizing that that's how things happen. And if you're not stretching, you're probably stagnating. And either whether you're doing it on your own, whether you're helping your mentee do it, whether you're helping your mentor do it. And I think we'll talk about in a minute, the imposter syndrome of this. I think we all still feel that. And sometimes you can push in both directions. I think a mentor can pull a mentee up and help them apply for a stretch opportunity. I think a mentee can push their mentor and apply for a stretch opportunity as well. And I think it's important just having this openness and the vulnerability that I think a lot of us are uncomfortable with, but we encourage our patients and families all the time. I think encouraging each other and encouraging yourself, that I think the best mentorships can come from some of that vulnerability, that just to put yourself out there. And while we all feel imposter syndrome, I think I saw in the chat that was a lot of what people saw as a barrier to mentorship or being a mentor. And I think for me, I always think back to, the first day of second year of residency, where you finish your intern year and you have this moment that, like, holy shit, you're going to be responsible for all these interns, and you didn't do anything all year other than write notes and put in order. So how can you possibly be responsible for helping mentor and teach another person? And then your intern comes up to you and asks some question about, like, if they can give Tylenol to the person with the fever. And you realize that, like, actually, maybe you have a ton to offer and you just didn't realize it before. And I think for anyone who's been in that role, whether you're a physician, whether you're a social worker, whether you're a nurse, whether you're a chaplain, thinking about sort of experiences. I know somebody put in the chat that being able to put yourself in the shoes of your mentee. I think having those experiences and thinking about, what it's like what did you not know a year ago? What didn't you know 5 years ago? The farther you go back, the harder it gets. But what did you not know at the beginning of your career? And thinking about, how far you've come and how much you have to offer. I think can be hugely beneficial. And along those lines, it's the idea of microloans of time. And so this is an idea that was developed to help people realize that, I think time was another one of the barriers people cited for challenges in mentorship. And I think there's the sense that, if you're making a meeting, it has to be an hour, because for some reason we've all decided that all meetings are an hour. But, if you, as you realize the things as you go farther in your career that that you didn't used to know, or that people more junior or less experienced may not know, in 5 or 10 minutes, you can potentially save someone hours of their day just by an offer of your expertise and help people answer a question they've been struggling with. And getting into the habit of looking for opportunities, whether you're the mentor and, like, you can, if you don't feel like everything has to be an hour, you can potentially help a lot of people with just small loans of your time. And from the mentee, being able to ask for a micro loan of time and saying, can I borrow 10 minutes between something? There's one specific question I want to ask you, and get your help with. And realizing that those micro loans can take off some of the burden of feeling like you don't have time to be the mentor or mentee that you want to be. Any other questions or thoughts from the group on this one?
Okay, so what works and what doesn't? So we will take 90 seconds individually to think of things that have worked and haven't worked through your mentorship relationships, and also kind of wins and growth opportunities. So take 90 seconds to think about this. And while you are thinking about that, we are going to work on breakout rooms. So these will consist of maybe like 2 to 3 people. And then in those 4 minutes that you're there, just share with each other what has worked, what hasn't, and some opportunities also to share some wins and growth opportunities. And then when we're about to come back, you can choose one person to summarize the discussion of the group.
Yeah, we got pulled back to the main group.
Oh,
We're still here. We're just with everyone else too. We're always with you.
oh, well, thanks, Jared. That was nice.
Welcome back, everyone. Thanks for managing the breakout groups, Naomi, because we had no idea how to do that. Could I get a volunteer to share something that came from your group about something that has gone well or has not gone well in a mentor relationship?
share. So Emily and I were together, and we had talked about how things that don't typically go well in our experience is having like a forced or assigned mentor. That you may not be able to get what you need from that person in your professional development, which then forces you to seek out other people to kind of learn from and manage up. And so we had talked about how that kind of just that forced relationship can be a challenge. And I had talked about how in a previous role, they had used kind of like a personality type test to match people, and how it actually went well. It was a small group of nurses, but how that could be also not the best way to match people up, especially if you don't want to be put in that box and you may not have those personality traits, all of them at one given time. That can also be a challenge. So any way that you're kind of forcing two people to be together. Of course, you have to assign people a mentor, preceptor, or whatever when they come into a new job, but it can be challenging when you don't get what you need.
Yeah, I agree. So many of the best mentor relationships happen more organically, based on shared interests, roles, ways that people relate to one another or their jobs. So I definitely appreciate that. Could I have another volunteer to talk about what your group discussed?
I'm happy to talk for our group. It was myself and Robin and Kathy. And we had some of the same, sort of discussion about not having an assigned mentor, but sort of these informal mentorship or organic relationships could really be beneficial. And we talked about having like set expectations of what the mentor hopes to, I guess reciprocally, what the mentor and mentee both expect of each other, and trying to make sure that that in that relationship that the mentor is invested in the mentee's career development and success, and truly sponsors that mentee, rather than sort of taking credit for or expecting that their career is going to advance, which sometimes does happen because there's reciprocal gain, but that there should be clear expectations and good intent in that relationship.
Absolutely. Thank you. Anyone else?
Well, in our group, I was with Jasmine and a social worker from Canada, where there she is, Megan. And I spoke of a sneaky, I couldn't remember the term, but a sneaky mentorship opportunity that I have quite often, which actually I feel better about now that I listened to this talk, where we're called in either as PPCs or ethics consults, because I do both, mostly ethics, but I work with both and sometimes do the other. Anyway, we're called into an ICU, and we have a sneaky mentorship opportunity with our colleagues and the staff.
Yes, I love that term. The sneaky mentorship happens all the time without us really knowing that it's about to happen. Who else would like to share? Stephanie, would you like to share from our group?
Yes. So our group was Claire, Shannon, and I, which is the social workers of here, the palliative care team. We thought it was a setup, but it wasn't. So our group mostly talked about what hasn't worked for us, since it's so common to hear of things that have worked. So we talked about what hasn't worked. And I think a common theme was that, the same, that someone who was supposed to be there for you kind of wasn't there for you. Tends to happen a lot, and then that just ends up being difficult, to approach, or how do you end it? Like it just ends up being messy, and you end up having to figure it out on your own. I know that happened to me during when I was training and in school. It was COVID time, so I tried to give a little bit more like grace to people who were supposed to be my mentors. But I now reflect, and I think it would have been really helpful to have that guidance so early on. And so, yeah, I think that was one of our biggest themes too.
Yeah, exactly. And one of the ways that a mentor of mine has helped to combat the unintentional not being there for one another is by setting up standing meetings. She's a mentor who does not live in my time zone. I have never met her in person, but we have standing meetings on like one Friday a month that we just keep on the calendar, and that way we know there's going to be a check-in. So that's a really helpful way to make sure that we're keeping on track and touching base, even if it's just over coffee and chatting. We don't have to have an agenda.
I agree with that. I was just going to add to that. I had one mentor a few moves ago who recommended that the mentees send an agenda. And I have tried to maintain that practice. I think it's more practical sometimes than others, but mostly for myself as a mentee, because it makes me really think about how do I want to use that 30 minutes or an hour that we have together. And I feel like sometimes we all get stuck in our everyday life and our care of patients or whatever our normal job is. And then to say, like, I need to be able to concretely write down what are the big things that I'm thinking about for myself that I want to kind of talk about with this mentor that's not just stuck in the details. And so I felt like it was valuable, not just for the relationship, but also for thinking big. So, Amy.
I love that, and I think that's a ideal state, and really that's like that idea you guys are talking about of mentoring up, of the mentee bringing an agenda. I'll also say that of the Abby Rosenberg School of Mentoring, who is of the Randy Curtis School of Mentoring, where you keep that standing meeting, even if you can't think of a damn thing to put on that agenda, because stuff always comes up, and it's actually in those spaces where things are going okay and I don't have a specific crisis with my research. But here's this other thing that actually, if we have a minute, I would love to just get your thoughts on. And those can be some of the most tender, kind of meaningful mentorship moments.
Thanks for sharing that. That actually alleviates my own distress, where sometimes I'm like, if I can't think of an agenda, then I should cancel the meeting, because that was the thought process of a different mentor I had a little while ago. And I think there's value in maybe it's the silence in practicing in palliative care, of like sitting in that silence and thinking, what then comes. Speaking of which, I love Catherine's comment. Like palliative care, some visits are more about rapport building. Totally. So this was a requested topic for NIPSI that back when we did surveys, mentorship was like a highly, highly desired topic. But in thinking about that, and even this talk, it wasn't clear what that meant, whether this organization should be a home for mentorship, there should be more discussion about mentorship. For anybody who wants to jump off mute or type in the chat or email us later, how can this organization help support your hopes for mentorship?
Have we heard from the mentees as to what they envision out of these relationships? I mean, can you hear me?
Yep.
Yeah. People sign up to get a mentor. They sign up as a mentee. They sign up as a mentor. I take it most of this room is mentors. For the most part, it would be interesting to hear from, I don't know where we get that information, but to get feedback from wherever these mentees are coming from as to what they want and what they see as going well and what they don't see as going well.
Yeah.
Now, how to do that, I don't know, but that I think would be informative. Having been in medicine for a lot of years, generations are all different. It's amazing how you change your teaching style about every 5 to 10 years because you've got a new group of residents and fellows and they don't learn the same way as the last group. And then, one wants didactics, one wants bedside teaching, one wants 1 minute lectures, one wants an hour and a half. And it's constantly changing. And this generation, and maybe it's because I've been through so many generations, seems that I'm hearing more and more, not just me, but from my colleagues about challenges with teaching and mentoring. And so I think looking at the other side of this might be informative.
Thanks. Oh, Naomi?
Well, I think to pick up where Elaine left off, I think it is really important to think about, can everybody hear me?
Yep.
Okay. It is really important to think about what people want from mentorship. And I'm going to challenge this group a little bit because I think, at least for myself, I'm often acting in the capacity of mentor. I'm now solidly mid-career and I feel comfortable saying that. But I do think as I learn new things or maybe take on new roles or try something new, I would also benefit from having a mentor. So I could also benefit by being a mentee. And I hope that I can have that attitude throughout my career. So I would encourage us, I know we're at the end of our time, but I think kind of all of us in NIPSI would encourage everyone present today to think about how can NIPSI best support this idea of mentorship? Maybe what does this mean to you and how can NIPSI support this? Asking that question a little bit more, and I don't know if we want to do this as a conversation on the NIPSI listserv, or feel free to email me. And Brittany, you asked the question, so
Yeah.
I'm gonna volunteer, email myself and Brittany, and to continue this conversation about how can NIPSI help with this idea of mentorship.
I just put my email in the chat for anybody
Great
who
idea.
wants. Yeah, I think it is. I feel like it's like you can never have enough mentorship, except that the time is a constraint. I think there's always things to learn. So appreciate everybody's thoughts about that, especially recognizing that I know Becky and I talked about like some of the isolation depending on the setting that you're practicing in as well. And so maybe some of it is more about connecting professionally and thinking about the benefits of that. So appreciate you all. Thank you to Stephanie and Jared and Claire for your perspectives and willingness to join me on this mentoring adventure today, and all of you on the call for participating and sharing your own expertise.
Can I do gratitude?